are watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, new breakthroughs in the treatment of gum disease. With us, we have an expert on the topic, Dr. Halaby. Dr. Halaby, welcome to the program.
Thank you for having me, Randy. Appreciate it.
You're a periodontist, is
Yes.
that right? And for people that don't know you or your practice, who's a typical patient and what are the different procedures that you do?
Okay, so the typical patient that comes in is going to be somebody that either have lost all their teeth, unfortunately, or on their way to that spot where they've
So
lost
general
all their
dentists send you people?
That's 100% of our business is just people referred over from general dentists. That's the vast majority of our patients. And they come in, either they've lost their teeth already or they're worried about that, losing their teeth. It's a big problem, it's tooth loss. So we're pretty much involved in both replacing teeth and preventing tooth loss. And that's, you know, in a summary way, is what a periodontist does. So more specifically, we do a wide range of procedures, ranging from simple gum grafts to correct, root recession if people have exposed roots, or more complex cases where they have a lot of gum disease affecting all of their teeth, or if they've lost all their teeth, and we have to rebuild everything that they've lost.
So getting into today's topic, okay, so gum disease or periodontal disease, same thing? Means the same thing?
Gum disease is more of an umbrella term.
Okay.
Underneath it there are many different diseases, but periodontal disease or gingivitis, periodontitis, more specifically, is gum disease. Yeah, I mean.
Okay. How big of a problem is it?
Oh, it's huge. It's huge. If you go by the last study, they showed that about half the people, half adults in the U.S. have some form of gum disease. That's more than about 100 million people. More.
Yeah, like 150 million people have gum disease.
Yeah, probably, yeah.
Now, with symptoms, okay, so in Texas alone, you say there's people, and
we've talked,
that have bleeding gums, all these things.
Absolutely. Millions of people walking around with red, puffy gums that have bad breath, possibly loose teeth, possibly on their way to being denture wearers, and we, in our practice, because we deal with restoring teeth that are already lost, we know, okay, it's doable, it's very possible, but it's also costly, and it's surgical.
So if you catch it early, this is reversible?
No problem.
Is
Absolutely.
that the challenge, though? People wait, because you say they wait too long.
Yeah, we hear it so many times. People come in and they say, yeah, I never thought I had a problem until now, and now they come in with a big swelling that big, and it's just way too late. So they don't have to wait until they have an abscess, basically. They should come in, and the best advice is go see your dentist for every six months to get a regular cleaning. Just go to the dentist. That's the best advice.
Now, I don't want to oversimplify this, but I'm trying to understand how this laser works. Okay. So it's a chronic infection in the mouth.
Right.
And you're saying you go around with the laser.
Right.
And it kills this infection.
Right.
Is it? Am I oversimplifying it?
A little bit. To understand how it works, let's go back to talking about the old way.
Yeah, let's talk about the. I guess there's what's traditional approach to getting rid of it, and what do you do?
Okay, so the traditional way is we'll get a patient referred from a general dental office, and we'll do our exams. We'll get to know the patient, and then first step is to get rid of the infection. So after they're ready for the surgery, the old way, right? We will do a cut around all the teeth that eliminates that infection. We're basically cutting it out. Now, it's important to understand why we do that. I don't have microscope vision. You don't, nobody does.
Okay.
For me to look at a patient inside their mouth and figure out which part is infected, which part is not, ain't gonna happen, right? So I have to cut a whole layer off.
Of the gums?
Of the gums.
Is there stitches involved?
Absolutely. Well, that's the first step, is doing the cut.
Okay.
And then we push the gums back a little bit, remove all that gunky tissue, throw it behind us, clean off the root surface, reshape the bone, add bone graft if I feel like the defect is deep enough, and then stitch it all back together.
That's the old way you say.
This is the old way. Now, it sounds horrendous.
By the way, that old way is happening
every day.
90+% of the periodontal offices in the country. Is that right?
Yeah. I don't know about numbers, but yeah, for sure.
Okay, sorry for interrupting. Okay, so you stitch it up.
Okay, so after we stitch it up, let the patient go. Big problem is that we typically do one half of the mouth and then they come back for the second half. Of course, they go home, a lot of pain, a lot of discomfort.
Do you ever call those people, by the way?
We call them every night.
And what do they say? I mean, in the old way.
Yeah, we call all of our patients every night. Yeah, a lot of pain. The problem is not the day of. The problem is afterwards, for good. They're just more sensitive.
Okay.
A lot of sensitivity, a lot of pain that is drawn out to the point that we typically will not see them back. Well, I don't want to say typically, but a lot of cases, we do not see them back for the second half. It's just a tough...
Second half of the mouth.
Second half of the mouth, yep.
Why is that? Because?
Just the experience is just so difficult on patients.
So they don't want to do it?
They don't want to do it.
Interesting.
Yeah. It's an unfortunate
reality.
reality.
So that's a standard way. When you go to periodontal school,
yes,
this is what they teach.
Absolutely. And you know, it has done a great service for a countless number of people that have saved their teeth. It's true that it has saved their teeth and gave them a whole new host of problems, being sensitivity and recession, ugly looking teeth, but it's healthier, and that's great. Okay. Okay. It works. It is a bit aggressive. I don't want to say a bit, it's very aggressive, but it works. And in some cases, it doesn't work that well either. Okay. Now, let's talk about the new way, because it's similar, but very, very different. So, the first step of the old way is cutting away all the infected tissue. Mm-hmm. Now, I don't have microscope vision, like I said. Okay. Right? Nobody does. Laser does. Okay. So, laser could identify and selectively remove the infected tissue. How? It's pretty simple. It's just based on color. Very
color
simple.
Of what?
The color of the infected tissue is more dark. It's red.
So like a bacteria?
The bacteria itself is going to be black or red. The infected tissue itself is a lot darker than healthy tissue. Healthy tissue in the mouth should be pink, not dark red. Okay. The darker the color of the tissue, the more infected it is, and the more the laser works on it. That's pretty much in a very simple way.
You brought a video clip.
Absolutely.
Would you mind? Let's have you narrate that clip. Sure. So we know what we're looking at.
Absolutely.
Okay, we're going to go to the clip. You're watching the Wellness Hour. We're talking about new breakthroughs in the treatment of gum disease. With us, we have periodontist Dr. Halaby. Okay, so this clip, we'll go to it.
The fiber optic tip is gently placed at the top of the periodontal pocket to begin removal of diseased tissue that lines the pocket. This is where bacteria live and build a neighborhood of its own that destroys healthy gum tissue and bone that holds your teeth in their proper position. There are specific germs and bacteria that cause gum disease. The Periolase laser is designed to target and eliminate selectively only the diseased tissue and germs, dissolving toxins and leaving the healthy tissue unharmed. The laser tip is then removed from the pocket and set aside. In the next step of the procedure, ultrasonic cleaners as small as a laser fiber tip are used to remove the hard deposits we call tartar or calculus from the top of the teeth and roots. These instruments use sound waves to vibrate and break apart the hard mineral calcium deposits, with water flushing away the debris and cooling the instrument tip. Some hand cleaning instruments may be used at this time to remove any remaining hard calcium deposits. Then the laser is used again at the bottom of the pocket to remove any remaining diseased tissue. This pass of the laser also sterilizes the tissue and bone and completely eliminates the bad bacteria, germs, and toxins. It also stimulates the formation of a blood clot, which once formed contains fibers that reattach your tissue to the tooth surface and seal out debris and bacteria like stitches would, and creates the right environment to cause the bone and other soft tissues lost from the disease to grow back.
Yeah, very nice. That looks easy.
You know,
is it easy? I mean, could I do it?
You know, the video shows it in an overly simplified way. And yes, it is that easy. Of course, there's a learning curve, and there are details that are not shown in the video. But overall, it's easier for us. Much, much, much easier for patients. And that's what counts. Never mind me. I'll work as hard as I need to. It's the patient that counts. If it's easier on the patient the day after, and the month after, and the years after, sign me up. This is what they should be doing, and this is what makes this protocol so successful.
What could people argue? You know, they could say, you know, I'm not an expert on this, and people need to know this is a real interview. I'm not endorsing you. Right. But what could an expert or a so-called expert say with what you're saying about this laser?
Well, you know, a lot of periodontists or dental professionals, specialists will disagree with the laser protocol. Will say it's a gimmick, it's a marketing tool. And the reason behind it, to be honest with you, I don't understand.
Well, is there science behind it?
Absolutely. Yeah, there's histology science, which means that they did a procedure, they got the tooth with bone in it, and they looked under a microscope, then there's new bone formed. There's 2 studies showing that, to date. Numerous other studies showing the beneficial effects of lasers in general to oral structures. So there definitely is evidence, and evidence aside, we see it in our practice.
So you have clinical experience
Absolutely.
that's showing that,
Oh, yeah.
Okay, but okay, so somebody goes in with moderate, I guess, bleeding gums, some loose teeth, early stages, right?
Okay.
Maybe some puffiness.
Right.
How soon does that stuff go away after you treat them?
Well, right away.
Really?
Right away.
Right away, like what?
Right away. Now let's talk about the advantages.
Like right away 2 days? Right away what? A month?
Right away when you go home. Done.
Really?
Yeah.
Interesting.
Now let's talk about the advantages since you mentioned that part. Number one, much more comfortable. And that is the number one thing.
As far as pain.
As far as pain for people, yeah, their post-operative experience is just almost non-existent. It's like
Okay.
they did nothing for most people. Second of all, we could do it all in one sitting. Remember I talked
You mean
about
the whole
half-
mouth?
Oh yeah, the whole mouth.
Okay.
We do the whole mouth in one day. And if somebody's a little bit afraid of the dentist or anxious or nervous, we definitely have solutions for that. We have IV sedation or oral sedation, something that could take care of that anxiousness.
So for the anxious person, because we talked, you say
Right.
that there's people with it and they do nothing because they're fear of the dentist.
Yeah. They know they're going to lose their teeth, but the fear is just so strong that they say, you know what, I just do not want to deal with it right now. I'm good, thank you.
Okay. So
Yeah.
so when you sedate, so you do the IV sedation.
Absolutely, yeah.
And that's safe, right?
Absolutely. Oh yeah, it's more than safe. It's the patients are monitored, so they're constantly monitored for their blood pressure, their oxygenation. Everything's under control. And remember, these people otherwise will just head towards dentures, and they'll be back to our office anyway to get implants. You know, and then their phobia is still there. The phobia does not go away with or without teeth. So it's extremely safe, and it's a blessing for people that are afraid to pursue what they need and they know they need. So oftentimes we'll be done with the procedure from start to finish, maybe 2-3 hour procedure, and we'll tell the patient, hey, how are you, Mr. Jones? You doing okay? He said, yeah, I'm doing fine. When are we gonna get started? You know?
Really?
Oh yeah, all the time.
They have no memory of it happening.
None, which is good.
Do they ever say, "Hey, that's it"?
All the time.
That-
All the time. You know, when we call our
Really?
patients that night, we call all of our patients in the evening, and the IV sedation patients is the best phone call because, you know, they'll say, you know, I cannot think of anything that I've ever done that's easier and more just easy, very comfortable.
We had a periodontist on my show. You know, our program airs all over the U.S. and all over Canada.
Okay.
And had a periodontist in Orange County, California. She said, "Randy, I've been a periodontist for 25 years. You didn't want to call the patient after traditional periotherapy that night or the next day because
Yeah.
they were complaining, they were miserable.
Right.
And now it's a pleasure
It's
they're
awesome.
happy.
Oh yeah.
because I always think people are exaggerating when I hear this.
Right, you know, the absolute, and this is the best part of it, the absolute worst part about the procedure is our diet instructions for them afterwards. We'll ask them not to eat any solids for about 5 days, and you know, strictly liquid diet. And that's the worst part of
In
it.
the old procedure, by the way, I guess you had to take a couple of days off.
Yes.
And we're talking about old, meaning the cutting
Yeah.
that's being done in over 95% of probably offices in the country for
Yeah.
periodontal treatment. But what about now? How many days off?
Typically we tell them none. We'll tell them, you know, if you want to take 1 day off and kind of, you know, recoup, if you will. But across the board, people just go to work next day. You know, some of our patients even want to squeeze it into lunch hour. You know.
Really?
Yeah.
You don't recommend that, though.
I do not recommend it. No, I do not recommend it. You know,
So
you'll
they're a
be
little
numb.
sore when it's all done.
Yeah, a
But
little
their
bit.
breath gets better.
Oh yeah, instant.
What's the connection between gum disease and the breath? That's
Okay.
the part I don't get.
Okay, well, bad breath is basically a bacterial problem. So is gum disease. Now, when you throw in an infection on top of bacteria, that's chronic. Now, remember, gum disease is a chronic disease. It's a silent disease. You don't know about it until it's there and established, and it's chronic. It takes years to develop. So if you get bacteria and you infect something and leave it for 10 years, yeah, it's gonna smell real bad.
Is that right? So under the gum line, there's like something rotting in a way? Or,
Absolutely.
Or
There's
is
gonna
it
be
gases are coming out of it?
Well, it's like you said, rotting. You know, it's an infection that's rotting away the tissue. Pus is often associated with that, and that's where a lot of these odors will come from.
So when it's all done, what do they say to you? Does anybody ever say, "I should have done this years ago"?
Oh yeah, you know, a lot of times we'll hear. Actually, the spouse will be the one that says, "Hey, thank you for doing that for my, you know, significant other." That we hear that pretty often. You know, the biggest thing is saving teeth. But not only saving teeth, there's a lot of quality of life issues that are treated alongside that. And odor is one thing, bleeding gums is another thing, loose teeth. You will not appreciate having solid teeth until you get loose teeth. You're no longer able to eat steak.
So it hurts when they chew.
Yeah, it hurts when they chew and they feel like they can't chew properly, otherwise they feel like their tooth might fall out. Yeah.
Well, how does the laser though make the tooth stronger? That's another part.
Yeah.
I don't get.
Okay.
What's going on there?
So it's an infection in the gum tissue. It's the supporting structures that are infected. It's your anchor, the anchor that holds the tooth in place. It's infected. When it's infected, it's loose. It's like sponge.
Why? Because the gums pull away from the tooth.
Gums pull away from the tooth. The bone is loose and infected, spongy. When you do that procedure, you're treating that part of it, and you're making the bone stronger, the gums stronger, the tooth more stable in its supporting structures. So you're basically adding foundation to the tooth.
So what is your challenge? Getting people to believe this? Getting people to come in to do treatment because they put it off too long?
Right.
I mean, what's the challenge? I mean, if the people that are watching, the chances are they got a little bit of bleeding gums, bad breath, loose teeth.
The biggest problem is diagnosis. This is by far the biggest problem. Diagnosis. People either do not go to the dentist. Some go to the dentist, but for some reason do not want to go see the specialist. And by the way, it doesn't matter who does this procedure. I'm not hung up on having periodontists do it. Anybody could do it.
But you're the gum specialist, right?
We are
that
the
true? A
specialist.
periodontist?
Yes, yes.
Does it cost more to go to a specialist?
As a matter of fact, in our practice, I think it costs a lot less. It's a matter of economies of scale. You know, that's all we do. Not all, but a lot of what we do. So because of that, the laser is a very, very costly piece of machinery. If you get it and you do one case a month or one case a year, you have to charge accordingly. But if you do it almost every day, then
so you love
offset.
This is the future. Do you think in the future this will be the gold standard?
I hope so.
Is that right?
I hope every dental office has it. It will hurt my business, but hey, it's better for patients.
But you have, I guess, this FDA-approved laser.
Absolutely. Yeah. Okay. Here's the thing. Not every laser is the same.
Okay.
There's a lot of physics that goes behind it that's very, very tedious. We do not want to get into right now, but it's not the same. And I tell patients, if you're going to get that done, make sure it's called LANAP. Now here's
LANAP.
LANAP.
What does that mean?
Laser Assisted New Attachment Procedure.
Okay.
It's a very, very cool procedure, and a lot of credit goes to the inventors. Now, they're very unique and they're very, very smart because what they've done, they will not sell that machine to anybody unless they go to training. It was a big deal for us. I had to fly out to California, close my office for 5 days, go.
Is that right?
Yeah, you have to close. You just have to fly out there, get their training, and it is so intelligent to do that, to make sure that people are not giving your machine a bad name, and make sure that they're getting the results that they should be getting using that laser. But yeah, to answer your question, not every laser is the same, okay, and they have to use that specific protocol to get these results.
So do they need to refer? Okay, so could they call you directly, or they go to their general dentist first?
Sure.
And ask for a referral. I mean, how does it work? If somebody's watching this, they want a consultation.
Somebody's watching this, go see your dentist. That's the biggest advice.
But they could call you.
Absolutely. We're more than happy to see people. We work with some very, very, very good dentists, some extremely sharp dentists that we work with. Phenomenal. So if they are not seeing a dentist, we're more than happy to accommodate that. But typically, the biggest advice I tell people, go see your dentist.
Now, I went to this the LANAP or LANAP website, and they have like a sticker that says no more cutting or no more stitching or something like that.
No cut, no stitch.
Because that's the standard way to get rid of gum disease.
Yes, there's incisions and there are stitches.
And this is like a bit of a movement, is that right?
It is, yeah, it is.
It's like that's old and this is new.
Absolutely, absolutely,
really?
Yeah. In our practice, in the past 2.5 years, we have not done, except for a couple of cases that are very, very unique. And had different things going on that are a bit technical, but pretty much across the board, we will use the laser to treat.
So laser works.
Absolutely.
Is it less expensive than traditional?
Here's why it's less expensive. Absolutely. Here's why it's less expensive. Oftentimes, you will require a deep cleaning appointment first, prior to the old surgery method. That is no longer needed. Second of all, bone graft. Bone grafts are expensive. You could use growth factors. They're very expensive. And that's fine. I don't mind going through that expense if it's for the patient's benefit. But with laser, we're getting equal or better results with no material at all.
And they're smiling again.
Absolutely.
They're dating again. Their breath gets better.
It's a whole quality of life improvement. Loose teeth. That's big. If you go out to eat with your family and you feel like you have to order mashed potatoes and soup only because you're afraid of biting into something and having a tooth fall out.
They need to go see you.
Yeah, they need to come.
Is that right? Sure. Okay, now, you have, and we're completely out of time, and I want to make sure you get this in because you showed me a photo. But you have a patient that was told from another dentist, all of your teeth have to go and you have to start wearing a denture. If I'm exaggerating, correct me.
That's exactly, this patient came in.
And you stopped that process.
Absolutely. This is that case right there. Yeah, so she comes in, okay?
That looks pretty bad.
Yeah, she comes in and actually very interesting. She comes in for a second opinion because her general dentist told her, yeah, you need dentures. There's just no way around it.
That means you had to pull out all those teeth.
Pull out all the teeth and get fake teeth, dentures. And if you don't believe me, go see the periodontist. I'm sure he's going to agree with me. And you know what? I would agree with him if I was using the old way still.
Okay.
But using lasers, we were able to.
So she comes in, and what happens?
She comes in.
How old is this woman, by the way?
I think she's in her 50s, if I recall correctly. She's got bleeding gums, loose teeth everywhere. Actually, she's very loose teeth everywhere. Just, really bad breath, basically. Okay. She works in the public. She does not want to change her smile.
So how, from the time she sits in front of you, thinking you're getting a second opinion, how soon before you say, hey, I can use this laser?
Okay.
And how certain are you that you can save these teeth?
That's a very good question. So we go through a very, very rigorous exam process that identifies various factors and various diagnostic parameters, and we use that to figure out, okay, are we going to be able to save teeth? And if so, in what condition are they going to be in, and how long will they last? In her case, we did the laser right away. We saved her teeth, and she has never been happier. I'm telling you.
Now, how soon though did you tell her? I mean, did you tell her on that first visit, or you?
No, we don't. No, we don't. We need the way we do it is a little bit different. We take a lot of diagnostic parameters the day of, and we have them go away. We do our homework in our office. We close the office for one day. We just sit down and go through every case, make sure we got everything down to.
So she was told her teeth have to go, be all pulled out.
Right. And
so when she comes back and you tell her that, she's got to be happy.
Oh yeah, she was ecstatic, and we saw her. Actually bumped into her out in the store about 6 months later. Her and her husband. And I'm telling you, the happiest patient ever is the patients that you could save their teeth and have them.
So depending on what study you look at, there's about 30 to 60 million Americans with an upper lower denture.
Right.
Do you think, in your opinion, that if caught early enough, that you could have wiped those people out? That means they wouldn't be wearing a denture if you caught them early enough?
Vast majority of the cases, yes.
Your opinion? Half of them? 80% of them?
Maybe 80%, yeah, I'd agree with that.
Did you cut them early?
Yeah, absolutely.
Really?
Absolutely.
Because nobody wants to lose their teeth, right?
No, absolutely not. And dealing with people that have already lost their teeth with dental implants, it's an awesome thing to do. It's costly, it's surgical. You don't need to go there if you don't have to. And laser is here to
So IV sedation. You also do, for missing teeth. I guess some teeth have to go. No matter what. You do dental implants as
Absolutely, yeah. We if we decide some teeth have to go, that's where dental implants come to play. We have a three-dimensional CT scan that we do that shows us very accurately where the bone is and how to treatment plan everything on the computer first before doing it in the mouth. And we're able to get people rehabilitated, healthy gums, healthy teeth, restore their missing teeth.
And does it really hurt?
Not really.
They don't complain about it, I mean.
Not really, no.
Okay.
Yeah.
And so you just go around. So it's a chronic infection.
Yeah.
You treat it like a bacterial infection.
Absolutely, yeah.
It's very interesting.
Absolutely, yeah.
That you could either get it cut out.
Right.
Which sounds silly because if you cut it out, you're still leaving.
You're still leaving.
You must be disinfecting the area even if you're cutting it out, though, right?
Yeah. Cutting it out is great and everything. The problem is you're exposing a lot more of the tooth on purpose. Now, if that happens to you...
On purpose? What do you mean?
You're cutting it away. You're chopping everything off, basically.
Okay.
If it's...
Is that barbaric to you, by the way? I don't want to put words in your mouth. Is that just really old school?
It is. It isn't if you look at it as an independent procedure, but when you compare it to laser, it's definitely very, very aggressive.
Another thing I was supposed to ask you, by the way, so gum recession.
Yes.
So a tooth is the gum is way up there.
Right.
How could that be? In what case is that gum disease?
Okay.
And is it an easy one to fix?
Yeah, gum recession is one of the signs that gum disease has taken its toll on the mouth. You know, you got to remember the gum tissue follows where the bone is, and gum disease is a bone disease. So if they've lost bone, the tissue will follow that bone upwards away from the tooth, and you get exposed root surfaces. So that's definitely one of the signs of gum disease, and that could be stopped.
Could you, and you as a periodontist, right? I mean, you do surgical procedures to give them back their gums.
Absolutely.
Is that right?
Absolutely.
So it's like a combination therapy of the laser.
Yeah. Oftentimes we'll do that, yes. Oftentimes we'll combine things, whether we're getting an implant or a gum graft in combination with the laser procedure. Absolutely, yeah.
Okay. Now, obviously, and we've talked, you'd love to get people early. When they're just bleeding gums, sore teeth, hot and cold sensitivity, those kind of things, bad breath. But could somebody be too far gone?
Unfortunately, yes, and that's where dental implants come to play, and it's a great service for patients. However, some people can be told that their teeth are all hopeless and they need to come out, they need to get dentures, either by their friends or even by dentists.
Okay. Like the lady you mentioned earlier.
Exactly like that lady. But, you know, with laser and with advanced procedures, that doesn't necessarily have to be true. So if you've been told that, please give our office a call.
Second opinion.
Always get a second opinion. Not necessarily with me, with anybody. Another periodontist, anybody that does laser, even a general dentist, anybody, it doesn't matter.
Okay, good. I want to thank you for coming on the show. Final message, somebody watching this, they're so afraid of the dentist. Maybe they haven't been in 10 years. They know that they have loose teeth, bleeding gums, sore teeth. They're starting to get loose. What do you say to them?
Go see a dentist.
And they're still skeptical, though.
Yep, go see a dentist.
Or they can call you directly, right?
Or call us directly, absolutely. We're more than happy to see them, absolutely.
So early treatment's going to save them money as well.
Oh yeah, a lot of money, because implants are very expensive. Could be expensive if it's a full mouth, and they don't need it if they could catch things early.
And save the teeth. I want to thank you for coming to the show.
Thank you so much.
Very good. Very good.
Thank you so much. Appreciate it.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, you could put in Texas laser dentist on my website at wellnesshour.com, or you could put in Dr. Halaby. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.